Hello, I'm Kevin Dolan, Alliance Director for Microsoft's Health and Human Services Industry Unit. Our alliance is a consortium of partners who are committed to delivering on the vision of providing consumer-focused, not program-focused, services for health and social service programs. They use a framework approach to doing that, committed to working together collaboratively. And today we have one of our alliance partners, President of InfoStrategies, also called InfoStrat, Jim Townsend. Jim?
It's a pleasure to be here. Thank you.
Great. Jim, one of the things we're going to talk about today is how you've used Microsoft platform and used the framework approach to breaking down those silos, specifically public health. Public health officials have inspectors that go out and into the field and work with controlling and reporting, oftentimes with paper processes, on diseases from tuberculosis and avian flu and SARS and AIDS and others. So how have you worked using tools, specifically Microsoft Dynamics CRM, to improve the processes and the efficiency and retention of these health inspectors and these program administrators? What have you done with the tool and how have you helped?
Well, the most exciting thing we've been working on lately is a new approach to application development. And Microsoft calls it XRM. Mm-hmm. That is using Dynamics CRM as the development platform for solutions. Traditionally, you do custom development where you start from a blank sheet of paper. We've done this for years with Visual Studio, with .NET, but with CRM we get a huge leg up because right out of the box it gives us a framework to build our solution much more quickly than we could coding it by hand. So with contagious disease tracking, we use the data model that CRM gives us for tracking people. We add all the custom attributes or fields that we need that relate to the particular diseases that we're tracking. We use the user interface that we get using Outlook, using Internet Explorer, even your mobile devices like a cell phone or a PDA. We use all of that to quickly build a solution to replace the paper-based systems or the systems that are cobbling together spreadsheets and documents, but they're not really structured. They're not really manageable to produce the reporting that we need to account for the tracking that we're doing. So a great example of that is tuberculosis case management, where there are business rules that we need to enforce. Business rules like the interval for testing and retesting, mm-hmm. and also screening for who the patient has been in contact with so that we can find those people and test them to check the spread of the disease. We even integrate with other systems like Virtual Earth to show the incidence of cases on a map, mm-hmm. which can be very useful to the healthcare worker.
So to be able to view at a high level, at administrative level, where these diseases might be prominent in a given zip code or city or range so that they could begin to target resources to address that.
Absolutely.
Great. So Jim has developed solutions for communicable disease tracking, tuberculosis. You've also developed solutions for health inspections. You want to tell a little bit about your health inspection solution?
You bet. So health inspection is on-site inspection, for instance, of a restaurant. A restaurant has periodic health inspections, and I'm sure you've seen those mm-hmm. certificates at your fine dining establishment. And I sure hope that you have. Or you read about it in the paper
right.
When there are health code violations. So field inspectors have to go out without IT support often, and sometimes using a clipboard and a piece of paper, go through their list of items that need to be checked, such as the temperature in your refrigerator and your freezer, the cleanliness of your countertops, and a large list of items. And then, depending on the outcome of that inspection, they need to get back out there and re-inspect. Mm-hmm. Well, even in our tight budgetary climate, government is still responsible for delivering these services, often delivering it with fewer people trying to do more with less. So by automating it with a proven off-the-shelf solution, we can help those inspectors cover more ground, literally, cover more restaurants, cover more facilities, and make sure that nothing falls between the cracks so they don't have to go back to the office and sit at a computer and re-enter that information that was written down on the clipboard. We can multiply their efforts and make it much more efficient.
Great.
We also integrate with the mapping so that we can quickly see where they need to go on their route today to come up with a good route to save time.
Got it. Well, that's a good example today of how our technology, our platform, is helping serve the needs of our public sector clients and breaking down the silos that inhibited access and quality outcome and delivery and efficient delivery of services. I want to thank Jim Townsend, our guest today. I've known you for over a decade, Jim. You've done great work supporting Microsoft's technologies and our joint customers. Really appreciate what you've done for us, and thank you for sharing your time with us today.
Thank you so much.